Hello, everyone. Hope everyone is enjoying their week today. Well, anti-aging, right? All of us don't want to age at all, but how can naturopathic medicine help all of us is the topic for today with Dr. Annie. Dr. Annie is a naturopathic physician joining me live from Canada. She focuses on women's health, aesthetics, pain management, and a whole slew of health concerns. Welcome, Dr. Annie.
Hi, how are you?
Thank you. So let's just talk about, obsession about anti-aging and then and role of naturopathy in that. And we'll go into more details on specific therapies that you use.
Yeah, of course. So, as you know, everyone talks about anti-aging and doesn't want to age. Women in particular are always trying to slow that process down. But what we find is that all of naturopathic medicine can really help because the way we look, our skin is actually a reflection of our health on the inside. So the healthier we are on the inside, it will reflect outwardly. So when we're talking about anti-aging with our patients, we do have specific procedures, which we'll talk about today, but we also want to include a holistic approach. And that would include talking about our sleep, how much water we're all getting, what kind of foods we're eating, and of course, what we're doing to our skin, our sun care. So it's bigger than just the procedures, but the procedures definitely help as well, and they're super fun.
Okay.
Do you want me to go into the procedures right away?
Please, yeah. So
Yeah.
I think we know that inside out, the beauty is not outside in, but I think we forget about it. All of us. So we want to get the best creams and all the kind of skincare out there, but the message here, Dr. Annie is trying to say is, well, skincare is fine, but it's the inside out, right? I just wanted to emphasize what you.
Yeah. Definitely. The main things for skin health is going to be how much you're sleeping. So we all need the minimum scientifically, all our evidence shows is 6 hours of sleep a night. Most people feel best around 7 to 8 hours of sleep. And the idea of getting your best amount of sleep is to create a sleep schedule so that you go to bed around the same time every night and get up around the same time every day. That is when your body will feel the best. And it's so simple that we forget it as adults. But if any of you have children, you know that with toddlers, you create a sleep schedule for them. They have their routine, they know when it's nap time or bedtime, and they have their bath and get their snack or whatever it is. We need the same thing as adults, but we don't do it for ourselves very often. But creating a sleep routine would be really, really great for our skin health. And then the amount of water that we drink is huge for our skin health as well. Because, like you mentioned, everything is coming from the inside out. So we want to hydrate our skin from the inside out as well. Most people, the goal I think everyone has heard is 8 glasses of water a day. A lot of people don't hit that. Most people are drinking coffee all day and not any water. But we should be hitting at least half our body weight in ounces of water per day. And for women, that ends up being around 2 liters. I always drink between 3 and 4 liters of water a day because you do want to replace anything you lose. So if you're exercising and you're sweating, you're losing more water, of course. And then if you're drinking diuretics, medications that can cause you to lose water, we want to take into account for all of those things. So on average, we should be hitting 2 liters. I always go for 3 to 4 liters, just because I feel best with that. That helps improve your digestion, basically lubricating everything inside. And then the other thing we do talk about is our diet. So eating healthy whole foods obviously is best for our body, but it's also best for our skin. When we take 3 grams of vitamin C per day, studies have shown that it gets to the dermal layer of our skin, which is not the skin that you're looking at. When we look at each other, that's our epidermis, and it's mostly dead skin cells. So we're getting nutrition and hydration from the inside. And we want that vitamin C to get to the skin layer because that is one of the ingredients to build collagen. And building collagen is what we want to do and how we make new skin, how we're creating this anti-aging process. It's more difficult to do after the age of 25 because unfortunately we stop making as much collagen as we break down. So after the age of 25, we're really breaking it down more than we make it. And that's part of our aging process. So that's what we focus on when we're dealing with skin and anti-aging. And I just want to go back and say, for that 3 grams of vitamin C a day, it does need to be in divided doses, because you only absorb about 1 gram of vitamin C at a time. So if you took all 3 grams at the same time, you'd be wasting a lot of it. So you want to separate that out throughout your day. And obviously you can focus on fruits and vegetables with high vitamin C content as well.
Wow, that's great. So maybe when you're eating an orange, eat like two kind of slices of orange, and then lunch and dinner, something like that, right?
Yes, add in where you can, exactly.
All right.
And then, so go ahead.
No. I was saying those are great tips.
Okay. I was just going to jump into the procedures, because I kind of alluded to the natural aesthetic way that we try to work is by building collagen. So the 2 procedures that we have at our office are the micropen and then PRP facials. And you've probably heard of PRP facials before. They've been talked about quite a bit as the vampire facial. That term is actually trademarked, so we can't say it, but it is essentially the same thing. When we're doing a PRP facial or using the micropen with PRP, PRP is your own blood. So that stands for platelet-rich plasma. We draw your blood out and then we separate it. We put it in a centrifuge and it spins very fast. So the red cells are heavier, they fall to the bottom, and we're left with the platelet layer on top. And that's the layer that we're using and injecting into the skin. So when we're doing that procedure, we numb up the skin and then we clean it off. And then we inject the platelet-rich layer into the skin. So we're putting it into different areas of the face. We can do your whole face though. We can also do your hands, your neck, the chest. We can really do anywhere that you have skin if you really want to. And we're placing the ingredients for collagen exactly where we want it. We're also tricking your body into making new collagen by causing damage to the skin. So if you think of when you fall and scrape your knee, your body automatically knows, oh, she fell, she scraped her knee, we have to go make new skin. So we're doing that to your face, but on a micro level. So you don't look beat up, you don't look like you've fallen and scraped your face, but we're creating the same type of healing cascade in the skin to trick your body to make more collagen and therefore make you new skin so you look younger and fresher. So the micropen, which can be paired with the PRP as well, is a pen-like device that has disposable needle tips. So there's 12 needles on the end that go up and down very quickly. And we use the PRP or hyaluronic acid as the lubricant on your skin. And then we drive that into the skin using the pen. So the difference between the pen and just the needle injections is that the pen is more superficial. It's not going quite as deep because it only reaches up to 2.5 millimeters. Whereas when we inject, we can go as deep as we need to. We can go to the bone or we can stay very superficial as well. So our favorite way to do the treatment is to combine both of those. So we'll do some injections. Usually people like the injections around their eyes. We can do into the tendons to kind of hold up, work against gravity a little bit, tighten the tendons holding our muscles on our face. And then we do the pen as well. So we're getting this superficial and deep layer treatment in one. And then we put a lot of hyaluronic acid on afterwards. So we're rehydrating the skin. And then over time, we're building that collagen. So we look younger and fresher. And everybody loves that treatment.
Wow. And this is amazing. So how's the difference? It's quite remarkable. I mean, the before and the after picture, and how long does it take with people start looking younger?
With results.
Yeah,
so it's dependent on where everybody's health is, of course, how much water they're drinking, how healthy they are to begin with. Because when we're using your own blood, you're only as good as your blood. So we want to use as healthy blood as we can. So that's as healthy of a you as we can. When we do the procedure, you look red at the time and a little bit swollen because we've injected a bunch of fluid into your face. It's not a frightening, scary kind of thing. Your redness kind of looks like a windburn or a sunburn, and you're red for up to 3 days. I always do the procedure and keep working. That's how not bad it is, I guess. And then what you notice is that night you'll go to bed. The next morning, people really, really like it because they're still a little bit swollen. So all of their fine lines are actually filled out. And then the liquid goes deeper. So we absorb it more and it begins to work. Our collagen is built over a 3-week period. So we want to do that procedure 1 time per month for 3 to 4 months in the beginning to really build on our results. And then we separate it out. So you could do it seasonally or once to twice a year for maintenance. And we just see beautiful skin results. Most people will say once they heal up, so in that first week, your skin is healing because we have, especially if we've done the micropun, we've really caused a whole bunch of micro tears everywhere. So your skin might feel dry for a few days, but then it starts to feel like brand new baby skin. And that's where we get that glow. And it's the building of the results over time that everybody really likes.
Wow. I can see the glow on your skin. Beautiful skin.
Yes, we've been doing ours for a while.
I need to fly to Canada to your office to get this procedure done.
You're always welcome.
Thank you. But how much does it cost? Not that we are selling anything here, but I never asked this question. But I'm tempted to ask this question for a lot of users out there who might be interested.
Of course. So the way we do it, we do our micropen treatment with hyaluronic acid for $275, so $275 plus GST, and then we do it paired with the PRP, the injections and the micropen for $599 plus GST. So I know that the PRP facials are actually more well known and quite a bit older in Europe, so they are a little bit cheaper. And in North America, it's newer, and so it is more expensive. On average, the price is around $1,000 typically.
I think that's very, very reasonable. Well, there's a lot of information for all the women out there.
Yeah.
Thank you so much. Anything else you'd like to share before we wrap up today? There's a lot of amazing information that you shared, and a lot of us, I think, would want to at least take a look into PRP facials and see how that works out.
Absolutely. It's definitely worth looking at. We have many happy patients that we do it with. And if you also didn't know, the PRP, like I said, it can be used anywhere on your skin. So if you have scars, if you want to minimize your scarring, if you have acne scarring or scars really anywhere on your body, you can inject it there to help reduce that. Also, if you're dealing with hair loss, so hair thinning and hair loss, we can actually inject PRP into the scalp and it can help with hair regrowth as well.
Wow. So it's a lot of women, especially when they're hitting menopause, hair thinning starts happening. I mean, that's a completely different topic right now. I don't want to go there, but just on a high level, that could be another use case of PRP, not only the face, right?
Yes, exactly. Lots of women, especially when they get stressed out, low iron, it causes hair loss. So once we get their nutrients and their health back where we really need it to be, because we don't want to waste PRP into the scalp if it's not going to work. So we do always want to check to make sure they do have enough iron before we're doing any types of those treatments. But stress is a huge cause, menopause. For some women, just aging in general, they have familial hair loss as well. But men and women, we've done the injections for, and with great success as well.
Okay. A lot of men would like that too.
Yeah, definitely.
All right. Well, I think a lot of amazing information. Thank you so much, Dr. Annie, for being with us. This is a quick 10-minute, 15-minute session we do. Not a medical advice, just knowledge and education. That's the goal. I just wanted to put a big disclaimer here because you gave a lot of amazing information. And yes, they keep supporting us. Thank you again, Dr. Annie, for your support. We are launching workshops. We're launching a lot of amazing products this month. So stay tuned. And thank you and have a great week.
Great. Thank you so much. You too.